Hello, I'm Dr. Bassett. I know you've made a very important decision to get your knee replaced. A lot of information has been thrown at you, and I know it's a lot and sometimes can be overwhelming. We wanted to create a video to go through some important things that can help you in your recovery. My physician assistant, Mark, is going to go through that with you, and hopefully, some of these things can help you decrease your pain and improve your function and get you through this process as easily as possible. If you have any questions, we're happy to see you anytime. You can call us or make an appointment with either one of my physician assistants or with me. Thanks.
Recently, we've changed how we have our total knee replacements go through rehab and recover after surgery. And we started doing what's called a quiet knee program that focuses on getting all the swelling and inflammation out. Swelling is really one of the things that makes it the hardest to recover after surgery. And having people do a home program of exercises helps patients to recover quicker and reach range of motion goals even quicker than the more traditional route. It can help save patients time and money because if patients follow the program, hit all the range of motion goals, then they can completely bypass physical therapy and continue with this program, which also by following the quiet knee program, patients often have better satisfaction scores, and it can actually reduce how much pain medication a patient needs in the recovery process. Well, some things that we are doing to try to aid the process along with the Quiet Knee program. The first one is specialized compression stockings. They're called longitudinal compression stockings, which are much easier for patients to get on and off. But they're also specialized in helping to more efficiently get swelling out of the leg. We've also started to use ice compression unit. These are specialized units that it's essentially an ice chest filled with ice and water. It has a pump on it that attaches to a pad that you wrap around your knee. As you use this, it circulates the ice water through, but these units also have a compression ability to apply gentle compression that helps to pump fluid out of the knee. And Route, which is a nutritional program that essentially helps build up all the nutrient storages before surgery and can help replenish those after surgery to help in the healing process. There's also Corganics, which is a CBD product that can help with pain and inflammation as well. Vita Support MD lymphatic formula, which also helps with nutrition. It's been shown to help with vascular and lymph drainage out of the legs. One other recommended procedure, some insurances covered and some do not, is called iovera. It is a process of 5 different sensory nerves at the knee that we find using ultrasound and can mark out. Then we use a tool that helps to freeze burn those nerves, which essentially cuts them and stops them from sending a pain signal to the brain. Those nerves gradually reconnect over a 90-day period. This is usually done at the pre-op visit just before surgery. So Inkwell is a new technology that we've started using. It's been out for about a year. It consists of putting a temporary tattoo on the operative knee at the end of the operation after I put the dressing on. Using an app on your phone, it utilizes the camera. You take pictures in certain positions with your leg out straight, with your leg bent, and through this app, it will actually synchronize with the tattoo and it will tell us range of motion. It tells us the swelling and it tells us the temperature of the knee. And that's all uploaded immediately on a daily basis to the providers so that we can see the progress of our patients. PT Mantra is a digital app-based physical therapy program. They often will be in conjunction with the Inkwell tattoo. It basically oversees the recovery process. This uploads every day to Dr. Bassett, who can then micromanage a patient's recovery. Some insurances don't cover PT Mantra, though they're still able to get Inkwell, which is overseen by the providers as well. And this uploads every day to Dr. Bassett, who can then micromanage a patient's recovery.